You came into the ER because you can't breathe, you're having chest pain, you may or may not be lightheaded, and you just feel that something is off. In the emergency department, the doctor diagnoses you with having a pulmonary embolism. Hi, I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician. I practice as a hospitalist, and my goal is to empower you and your family on better understanding diseases that get you into the hospital. So what's a pulmonary embolism? For sure, it's a blood clot in your lungs, in the pulmonary arteries of your lungs. They usually develop in the deep veins of your legs. These are the large veins that you really can't see. And once the clots form, they do cause some concern for physicians, especially when it comes to where they head. A blood clot can lodge itself into the arteries of your lungs, thereby contributing to problems with oxygen exchange. See, the way this works is that your heart sends blood to the lungs for one purpose, to pick up oxygen. But when you have a blood clot that, for lack of a better word, is obstructing traffic, then that blood can't get to the lungs, and that's the problem. You can't have a heart attack, you can die if the blood clot is large enough. So why is it that some people develop blood clots? Well, think of this, anything that prolongs your immobility, such as sedentary-like behavior, being in a bed for too long, being in a chair, having a long car ride or a long plane ride, and you're not taking enough breaks, or let's say you're a truck driver or you drive for a living. These are all very hazardous situations for developing a blood clot, and it's important to get up and just move around every so often. Other factors that can contribute to pulmonary embolism formation, or PE, would be genetic factors. Or let's say you're a smoker and you're taking hormones in the form of birth control or estrogen replacement for perimenopause or menopause symptoms. If you're a smoker, you need to stop. So these are the factors that can contribute to some people forming blood clots. In a small percentage of the cases, we can't find a cause. But also don't forget that if you have a hip replacement, that's a very high-risk situation of having a blood clot in the first 21 days, and your doctor who performed the surgery will likely give you a blood thinner for prescription. So you've been diagnosed with a pulmonary embolism. Your doctor is likely going to check a series of vitals in order to arrive at the diagnosis. Blood pressure may or may not be affected. If it's low, it could indicate some serious formation of clot. Respiratory rate, which is your breaths per minute, may or may not be high. Heart rate may likely be high. The human heart beats anywhere from 60 to 100 beats per minute. Now, if you're very athletic or if you exercise regularly, your heart rate may be low as is, usually 60 or even lower than 60. Patients who are on certain medications may have heart rates lower than 60s. But in this setting, we are looking for heart rates that are faster than 90 to 100 beats per minute. And then temperature, you may have a fever. Oxygen saturations will likely be low. This is the oxygen level of your blood. So they'll do a series of blood tests, and then they'll do a chest x-ray. The chest x-ray cannot be used to diagnose a blood clot. Your doctor is ordering the chest x-ray to ensure that there's nothing else going on. In the vast majority of cases of people who have pulmonary embolism, their chest x-rays are normal. You can't see a blood clot on a chest x-ray. To diagnose a pulmonary embolism, or PE, you have to get a computed tomography scan, or what we call a CT for short. It's a large machine. Your body is lying on a stretcher and it goes in and out of that machine within a few minutes, and that machine takes thin slices of your thorax, which is basically from here all the way to your upper abdomen. This allows the radiologist to find the blood clot and present the diagnosis. So if you've been diagnosed with a blood clot, you're going to have to be on blood thinners for 3 to 6 months. Your doctor's going to tell you if it's 3 or 6 or even longer. Now, there are quite a bit of complications associated with blood thinners and blood clots that we'll discuss in later videos. You may or may not be admitted to the hospital. Most people who are diagnosed with a blood clot are prescribed a blood thinner and then are sent home from the ER. But in a small percentage of the cases, we do need to admit you. Often you may be admitted under a short observation, which is usually under 24 to 48 hours. Very few people are admitted to the ICU, but that does happen. Until next time, we'll discuss blood thinners.